بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Our skill lab will be about rehabilitation after fracture. Okay. First of all, rehabilitation after fracture, I mean that we are going to deal with patient after removing the cast. Okay. After finishing with the orthopedic surgeon. So, main points should be kept in mind before starting rehabilitation, that usually fracture heal within 4 to 6 weeks, but sometimes it can take several months, depending on the extent of injury and the general condition of the patient. I mean that there is a big difference between young patient with any chronic diseases with post-fracture complication, and an old patient with, for example, chronic renal failure. There's big difference between the healing in this patient and the other one. Okay. Sometimes casts or braces are often removed before complete healing in order to prevent the joint stiffness or what we call post-fracture stiffness. But keep in mind that once the bone is healed, it is safe and you must begin muscle building. First, let's summarize the main causes of fractures as you took in the PBL, inshallah. The main causes of fracture is trauma, whatever the type of trauma. It could be high impact sport injuries, trauma, overuse, or what we call the prolonged long distance walking or running. This is what we call stress fracture, falls, accidents. All of these are traumas. But there are some bone diseases that weaken the bone and make the bone more vulnerable for fracture, even with minor trauma, as in osteoporosis or tumors growing near the bone, or secondaries, metastasis I mean, okay? So the main causes of fractures are trauma or bone diseases weaken the bone like osteoporosis and secondaries or tumors growing near the bone. The types of fracture is either simple fracture, I mean that the fracture is only simple line of fracture or only fracture in the bone only in one side, okay? Closed fracture, I'm talking about the overlying skin that it is intact, it is not pierced by the bone endings. The opposite is open or compound fracture, I mean that the fracture leads to the bone ending is piercing the skin and there is a big wound and the fracture site is exposed. Undisplaced fracture, here we are talking about the alignment of the bone endings in the fracture line. If it is in alignment, so it is undisplaced fracture. But if it is not in alignment, so it is a displaced fracture. And the green stick fracture, which occur in children, where fracture on one side of the bone leads to bending on the other side of the bone. Comminuted fracture, I mean that the site of fracture there are many bone fragments or more than 2 or 3 bone fragments. For example, this is a simple fracture. It is only one line fracture. This is a green stick fracture here. As you can see, this is the fracture and this is bending to the other side. This is a comminuted fracture. The fracture site contains many bone fragments. This is what we call the open fracture. Here the bone ending is piercing the skin, and we can call it also the displaced fracture. And this is a closed, undisplaced fracture. So, what are the complications after fracture? Mainly, the complications after fracture usually occur due to the prolonged immobilization. As we mentioned before, that healing or the patient stay in the cast for 6 to 8 weeks, 4 weeks, according to the extent of the injury and the general condition. So the prolonged immobilization after removing the cast, the patient will come for you complaining of pain, joint stiffness, ligament stiffness, muscle weakness and wasting, what we call disuse muscle wasting, loss of function of the joint. For sure, there's pain and limitation of movement due to the stiffness and the muscle weakness. So, to rehabilitate this patient, you are going to correct or you are aiming to correct this complication in order to restore the normal function of the affected part. So, Our aim of rehabilitation after fracture is to decrease pain, restore muscle power, restore the flexibility of joint and ligaments, restoring the maximal possible function. Our rehabilitation program will include 3 main points: the physical modalities, the exercise, and splinting. The physical modalities includes massage, heat therapy, cold therapy, and electrotherapy or current therapy. We are going to discuss one by one. First, the massage. The main mechanism of action is first relaxation. For example, when you wake up with severe muscle or muscle spasm or neck pain due to abnormal position while sleeping that leads to muscle spasm, reflex, you can rub by your hand, you rub the neck or you rub the muscle. This rubbing movement, what we call the massage, will lead to relaxation of the spastic muscle. Okay? Also, the rubbing movement or the massage will lead to some sort of vasodilatation, which help to remove the waste product or accumulated waste product and bring the nutrients to the affected part in the form of oxygen and nutrients, what we call the improved circulation. In turn, it will relieve pain and tension, and for sure, nourishment of the muscle. I'm talking about the massage, which is the first item in the physical modality in rehabilitation program of rehabilitation after fracture. Second modality is heat therapy. The mechanism of action is the same of massage, through vasodilatation, also relaxation, removal of waste product and bringing the nutrients to the affected parts through improved circulation, pain and tension relief, nourishment of the muscles, and which is characteristic for heat is biological and enhancement of regeneration. Okay, I mean that heat therapy, especially the deep heat therapy, is characterized by it can help healing of the affected tissues, as I will mention. Okay. Before applying any type of heat, whatever, superficial or deep, there are contraindications for using heat therapy. So, don't forget to test the skin sensation, because if there is defective skin sensation, it will lead to burn. For example, your patient is chronic diabetes, prolonged diabetes, uncontrolled diabetes. So keep in mind that he may have diabetic neuropathy. If you didn't test the skin sensation before applying the heat, you can cause burn for the patient. If there is defective arterial or venous blood supply, applying heat and further vasodilatation, as I mentioned in the mechanism of action, for example, it may lead to DVT or deep venous thrombosis. It is contraindicated, absolute contraindication, to apply any heat therapy for any patient with malignancy or infection. In these cases, malignancy and infection, heat will help for dissemination of malignancy or infection. Okay? So these are the main complications for heat in general, whatever superficial or deep. For the types of heat, we have two types, superficial and deep. Superficial and deep according to the depth of penetration of the heat. We are going to talk about the examples of superficial heat first. We have two examples and one example for deep heat. For superficial heat, our first example, this is what we call the heat lamp or infrared lamp or the radiant heat. Okay, this is a lamp. As you can see, it's red in color. It emits infrared rays or radiant heat. Okay. The superficial heat in general heat the skin and subcutaneous tissue, which leads to relaxation and free mobilization of the skin only. Okay. For positioning of the lamp over the patient, the lamp is opposite. This lamp should be opposite the center of the treated area. The rays should strike the skin at right angle. This allows maximum absorption. The distance between the lamp and the patient should be from 50 to 70 centimeters. The patient face should be covered, not exposed, especially the eyes. You should give the patient eye goggles to protect his eyes. And the duration of using infrared rays or heat lamp shouldn't exceed 15 minutes. This is our first example for superficial heat therapy. Our second example is what we called paraffin wax. Paraffin wax, its components, this is a tab. It contains paraffin wax and mineral oil mixed in a ratio of 7:1. Okay, so again, it's a paraffin wax mixed with mineral oil in a ratio 7:1. It is used for post-fracture stiffness of the upper distal extremity, I mean the hand and the wrist. How we use the paraffin wax? The extremity or the affected part is dripped in and out in the pus for 4 or 6 times till a thick layer of wax is formed over the skin. Then it is wrapped with plastic or proof paper, and after 20 minutes the wax is scraped off, and then you can repeat it again. Okay, this is the second example for superficial heat. As I mentioned, in general, as a contraindication for heat, defective skin sensation, defective blood supply, malignancy and infection, and in case of wax bath, it is also contraindicated to be applied for open wound or edema. Now we are going to move to the example for deep heat, as the superficial heating methods don't effectively reach the muscle. Our example will be the ultrasound. Inshallah, the whole physical modalities, you will take it in details in your clinical seminars. Our example, the ultrasound, this is the apparatus, and this is the head of the apparatus, okay? And this is the coupling media, or what we call the gel, for example. The ultrasound is used in post-fracture joint stiffness, as it breaks the joint fibrosis and adhesions caused after prolonged immobilization. This head will emit ultrasound waves. It emits the ultrasound waves in 2 manners, either continuous emission or pulsed emission. Continuous emission, as I mean, it means that the whole duration of the session there is emission of ultrasound waves. In pulsed manner, the session there will be emission of ultrasound waves for 2 milliseconds, for example, and then 2 millisecond rest. There are indications for the continuous ultrasound and pulsed ultrasound. Pulsed ultrasound is used in fracture with metallic fixation. So, it is contraindicated to use the continuous ultrasound in metallic fixation. Why? Because if I apply continuous ultrasound for patient, for example, with plate and screws in the femur, or for example, intramedullary nerve, whatever, okay, he will not feel anything during the session. But after the session, he will suffer from severe pain due to accumulation of heat within the metallic fixation. So if your patient is with corrected fracture with metallic fixation, you should apply pulsed ultrasound, not continuous ultrasound. Okay? This coupling media is very important to be applied between the head of the apparatus and the skin of the patient. It allows the transmission of the waves to the body. This coupling media may be gel or water. If this coupling media is absent, there will be reflection of the ultrasound waves to the head or to the apparatus again, and this will lead to destruction of the crystals, and it will not be a good session. In deep heat or in ultrasound, the depths of penetration of the ultrasound waves will be for 3 or 5 centimeters, so it can reach easily the muscles. And as in the superficial heat, the maximum duration will be for 10 or 15 minutes. This is how we apply the ultrasound. This is the apparatus, and this is the cap, and this is the head of the apparatus. The therapist is holding the elbow, and this is the apparatus, and here there is a coupling media, water or gel, and there will be a circular movement of the probe over the affected parts. Okay? We will move to the third part of the physical modality. In order not to be lost, we are talking about rehabilitation of patient after fracture. I mean after removing the cast or after his operation. The patient is usually, to summarize, in pain, stiffness, and muscle wasting. I'm going to correct these complications in the form of physical modality, exercise, and sprinting. We are talking now about the third type of physical modality, which is cryotherapy. The first two were massage and types of heat, whatever deep or superficial heat. In cryotherapy, you are using cold baths. In general, cryotherapy is used usually in the acute fracture early to relieve the edema and for analgesia. But later on in our state here, we are treating the patient after removal of the cast or post-fracture. It is used to relieve pain, analgesia also, and muscle spasm. But the main mechanism of action of cryotherapy is vasoconstriction followed by reflex vasodilatation. So it improves circulation and the help for regeneration. Okay? Cryotherapy in general, even in acute or chronic stages, is used for analgesia as cooling of the skin lead to decrease of the nerve conductivity. So it will lead to analgesia. Our last type in physical modality is electrotherapy, or what we call using current as a physical modality. We have three types of current, either galvanic current, Faradic current, or TENS. The galvanic current or in general the electrotherapy aimed to correct to some extent the muscle wasting through contraction and relaxation of the muscle or re-education of the muscle action and so on. But the different types of current are used according to the state of the muscle. For example, the galvanic current is used to stimulate the muscle for contraction and relaxation in case of denervation. I mean that you are applying the galvanic current on a muscle that has no nerve supply. Its nerve supply is not intact. For example, cut the nerve during the accident or the fracture or whatever the cause. If you want to cause contraction and relaxation of a innervated muscle, I mean that muscle with intact nerve supply, I will apply Faradic current. Okay? The contraction and relaxation will allow to improve to some extent the muscle wasting, and for sure it helps the metabolism through increase the blood supply. The last type in electrotherapy is TENS. This is transcutaneous electrical nerve stimulation. In transcutaneous electrical nerve stimulation, it is used mainly through analgesia or to cause analgesia, as it stimulates the sensory component of the nerve to decrease the pain. But if you increase the intensity of the current, of the TENS current, it may lead to contraction and relaxation of the muscle also. Okay? This is the electrotherapy. As you can see, this is the electrotherapy. These are 4 pads. Okay? It is applied with gel also over the skin, and you adjust the intensity of the apparatus till you can see the contraction of the muscle by your eye, and keep in mind the patient shouldn't feel pain. Okay? The second item in rehabilitation after fracture, after physical modality, is exercising. Exercising is very important to build the wasted muscle. As I mentioned, it is one of the main complications after fracture. Types of exercise will include passive exercise or active exercise. First, the range of motion. I mean the movement within the unrestricted range of motion for a joint. It is either passive or active. Passive exercise, I mean it is produced by external forces that, like the therapist or the doctor. The patient has no rule. But the passive exercise doesn't prevent muscle atrophy. So this type is used when patient cannot actively participate in exercise, no effort is required from them, and it doesn't correct the joint atrophy. So I will move to active exercise. Active exercise is produced by contraction of the muscle crossing the joint. It is used when the patient can exercise without assistance, or the patient must move their limbs by themselves without any assistance from the therapist or the doctor. But active exercise may be active assistive exercise or active resistive exercise. For example, active assistive exercise. If I ask the patient, for example, to flex his elbow, and he starts by himself completely without any assistance from me, he starts to flex his elbow, but he cannot reach the full range. So I will apply some assistance to finish the full flexion of the elbow. This type is used when muscles are weak or when the joint movement causes discomfort, patient must move their limbs, but a therapist help them do so or to continue the range of motion or to continue the action we ask it to do. This is what we call assistive active exercise. The resistive exercise, the muscle contraction is resisted by external force, either by weights or elastic bands, okay? And in resistive active exercise, when I ask the patient to do the full range, he can do it easily. For example, I ask the patient to do full flexion of the elbow. I can do it alone without any assistance. So to improve the muscle power and to increase the muscle power, again, I can apply some weights in his hand to do it with resistance. This is what we call active resistive exercise. So I have passive exercise, active exercise, which include assistive and resistive exercise. And the third type is stretch exercise. Stretch exercise is a therapeutic maneuver used to elongate the shortened soft tissue structures. So I aim to increase the range of motion. Okay? So stretch exercise is a therapeutic maneuver to try to improve the range of motion if there is fibrosis or adhesions. I'm trying to elongate these fibrosis or this shortened soft tissue to regain the normal range of the affected part. But it is contraindicated in patient with bony block or severe pain, inflammation, edema, or infection. These are some examples for exercise, and here it is completely active exercise. There is no therapist or doctor assisting the patient. The patient is doing flexion, extension, adduction, and abduction for the shoulder. This is for internal and external rotation of the shoulder. This is what we called wall crawl to improve the range of motion of the shoulder joint. Here he's doing flexion and extension of the shoulder by himself. Active exercise here also. Here it's not active exercise only, it is active resistive exercise. This is an elastic band to improve or increase the muscle power. Here also active resistive exercise for external rotation and internal rotation using the elastic bands to resist the movement, as you can see. And this is for active resistive exercise also for internal rotation of the shoulder. Here the patient is actively exercising the hip for extension, lying prone, like as you can see. And here flexion of the hip, active exercise. Again, flexion of the hip and then extension back. This is for external rotation and internal rotation of the hip, adduction and abduction. And the last item in our rehabilitation will include splinting. Splinting or braces usually is prescribed for the patient if there is partial healed fracture in order to protect the affected part. As you can see, this is a rigid part applied to the affected area in order to protect it from any trauma or any forced movement or whatever. There are two types of splint you should know. Either rest splint, I mean rest, R-E-S-T, not rest the rest joint, okay? Rest splint, so the affected part is resting in the splint, resting, okay? Cannot do any movement, and I'm applying rest and protection for the affected parts. This is what we call rest splint. And there is another type, what we call functional splint. As you can see, this is the splint, and it is reinforced by, these are spring wires, okay, that allow extension of the digit and the rest. And this is applied, for example, this case is with fracture in the humerus and there is radial nerve injury, so there is rest joint drop, okay. So I can apply functional splint like this for the patient to allow extension of the fingers and the wrist, so prevent the disuse muscle atrophy. Note here that the fracture here, or the causes of radial nerve injury here, is due to fracture in the humerus. So here I'm applying the splint away from the site of the fracture, okay? So it's finished, this skill lab. Okay, it is so simple and easy. But to summarize in brief in only 3 minutes, I'm talking about rehabilitation after fracture, dealing with patient after removal of the cast or he already finished his metallic fixation, his operation. The types of fracture, the causes of fractures are mainly due to trauma, falls or accidents, and bone diseases that weaken the bone and make it more liable for fracture with minor trauma like osteoporosis or secondaries. The types of fracture I mentioned: simple fracture, closed or open fracture. This is according to the overlying skin, displaced and undisplaced, and comminuted fracture or green stick fracture as in the children. The prolonged immobilization of the patient in a cast will lead to pain, loss of flexibility of the muscle and the joint, and disuse muscle wasting that will lead to the loss of function of the affected part. So our rehabilitation aims to correct this complication. Our rehabilitation will include main 3 items: the physical modality, the exercise, and splinting. The physical modality, we talk about massage and heat. Massage, the main mechanism of action, relaxation, improvement of the circulation and nourishment of the muscle, and so on. Heat, in general, the main mechanism is like massage, but don't forget to the characteristic mechanism of action is the power of regeneration or the biological effect. There are 2 types of heat, superficial and deep heat, and we mentioned that there are 2 here we have only 2 examples for superficial heat: radiant heat and paraffin wax, and for deep heat, ultrasound. The difference is the depth of penetration. In deep heat I can reach the muscle, but in superficial heat it only heats the skin and subcutaneous tissue. In general, the main contraindication for heat is defective skin sensation, defective blood supply, malignancy, and infection to avoid its dissemination. And then we move to cryotherapy, applying cold packs, mainly to decrease analgesia, to decrease the nerve conductivity of the, applying cooling to the skin, applied nerve conductivity, so it helps to relieve pain, analgesia. And then the current therapy or electrotherapy to cause contraction and relaxation and improve the metabolism of the muscle. If it is a denervated muscle, I will apply galvanic current. If it is an innervated muscle, I apply the faradic current. And for stimulation of the sensory component of the nerve to decrease pain only, you can apply transcutaneous electrical nerve stimulation, which is TENS. Okay? And then we move to the second part of rehabilitation, which is exercise, but it's by its type: the passive exercise, active assistive, and active resistive, and the stretch exercise. And lastly, the splints, which is 2 types: either rest splint or function splint, and it aims to protect the affected part from further injury. And that's all, and I hope it's clear and you're not lost from me. Thank you very much for your time.